Okay, so we're going to be taking a look at artificial insemination, and the method that we're going to be using for this is intrauterine laparoscopic insemination. One of the first things we're going to look at is a table with some of the equipment to be used. As we pan around the table, you'll see a collection tube, which is known as an artificial vagina. You'll see some gauze and paper towels. Um, You'll have thaw basins for warming up frozen semen. There's a warmer that's used so you're not having to keep the ewe or doe in an uncomfortable position for very long. You can take and get your insemination guns loaded with the sperm that you're going to need, and there's a warmer to keep the sperm warm until you actually use it for inseminating the ewe or doe. There's a basin with some antiseptic in it for the instruments that are being used on the animals, just to help reduce the potential for infection. And there's a little staple gun there. That way, when we're done, typically they don't need anything done as far as sutures or whatnot, but you do get some that will have a little bit heavy bleeding afterwards, and you may need to apply a couple staples just to close that up to keep them from bleeding. One of the things as we kind of get into this too in some of the other videos, um, and things to think about whenever you're getting ready to do intrauterine laparoscopic insemination. Typically, you want to withhold food for about 12 hours prior to the procedure. Uh, this is to help you or help the person that's doing the procedure, as in their stomach will be relatively empty. That way, you've got room to move in the abdomen area. Um, Typically, you're going to bring the user dose up that you're planning on artificially inseminating. You're going to figure out, depending upon how many people you have there and how fast you can run through them, you'll sedate them. And usually you only want to do a small group. You don't want to have a bunch of them because the sedation doesn't last overly long. You'll probably get about 30 minutes worth of sedation, depending upon their metabolism. So you want to only bring up a small handful, bring them in, sedate them, and then once you've got them sedated, you're going to bring them in and put them on a cradle. It's an artificial insemination cradle, and this cradle locks into a horizontal position. And then when you're actually ready to do the artificial insemination, you'll tilt that table so that they sit at about a 45-degree angle with the area that you need to work on being right there at a nice comfortable height to work on. Uh, Depending upon the person that's doing this, they may or may not use local anesthetic at the site where you're going to be making your slits for inserting your cannulas. So you're going to have one, and if you look at it as we go through the videos and pay attention, you'll have each of the slits, one will be on the left, one will be on the right, and roughly in line from where their teat is at, roughly, give or take. And it may change a little bit because if they've been artificially inseminated before and there's noticeable scar tissue, they may move off to the side of that, to the left or right, just a little bit, so they're not continuing to create more scar tissue in the spot. Once the cannulas are inserted, then what will happen is typically on the left, they'll use a scope. Typically has a light on it and has a scope. If they have the fancier setup, they may have the camera on it, so it actually hooks up to an external screen, which is kind of cool to watch. And then they'll typically infuse some carbon dioxide into the abdominal cavity. And what this does is help push the stomach and the bladder and everything out of the way, so that as they're putting an insemination gun into the right cannula, they're able to see and visualize the uterine horns and the insemination gun. Typically, they will inseminate each uterine horn. And then once they're done, they'll withdraw everything and they'll release the air out of that abdomen. Just help. Some of them do, some of them don't. The ones that we were working with out here, you'll notice in the videos that they will push in on the sides while they have one of the cannulas still in place, so that the air from the abdomen that we put in there, or carbon dioxide, is released back out. Just kind of like if you leave it in there, it's kind of like feels uncomfortable. It's kind of like us when we get gas. We feel that extra pressure in there. So you can release it to help them, make them feel a little bit better. Don't absolutely have to. There's nothing negative that'll happen if you don't. All right, so as we take a look at doing artificial insemination, no matter which method we're using, one of the things that's kind of important in this process is checking the sperm. If you've just collected a buck or a ram, you're going to want to go in and check your concentration of your sperm, your total motility, your progressive motility. And in this case, you can check and see how much volume of extender you'll need to add, if any, and the number of doses you'll be able to get out of the sample of sperm that you took. Typical dilutions here, 15 to 450 milliliter for concentration, 15 to 450 milliliter, or million, sorry, per milliliter for total motility accuracy, and then 15 to 100 million per milliliter for progressive motility. The individual that is actually going through and checking the sperm is using a app known as iSperm. Pretty nifty little app, and it has a little microscope attachment that you can put over the camera of your iPad, and it will act like a microscope, and it'll show it up on the screen just like as if you look at the microscope, and it'll actually do this calculation for you automatically, which is nice, especially if you're collecting a bunch of fresh semen, because now you know what you need to dilute down to and how many doses you'll get out of that particular collection. So kind of nifty little deal. Not necessarily on the cheap side, but if you're going to be doing this, or if you're going to be collecting your own bucks and rams, it might be worth the investment, so that you know what kind of, or what quality of semen that you're getting from your animals.
81. Which one? Walker's Weathers Reserve 4. Oh, that was out of 1618, which was a full 1618 is Pocket Change's mom, the Buck Newsom bought from me. And she is a full plus sister to Quit It Some More. Quit It Some More was 5814 times 234 green. 234 green was a Mozart.
You still have that
Quit It Some More, no, he died. But 81 was a son. And then see, he was out of 71, and 71 was out of Quit It Some More. We've been a 3/4 brother to 81. About the same.
What's the deal? An infection? Or?
I would probably put him on an antibiotic just to make sure, but I mean, it's just a lot of dead in there, a lot of abnormal. I think the one this morning was better.
Really?
Yep, I do.
Give them.
It is 10:15. Got a date?
While they're here, we might as well. The one that goes up, they ain't guaranteed you time. We'll jump on one.